Hello, this is Dr. Ken Tombley. As you begin to work through Module 2 and 3, it will be helpful for you to understand some key terms and their meanings that are used to talk about different types of counseling. Model or theory, methodology, and interventions. Let me liken it into a house or a building. Every building has a foundation, it has walls, and it has a roof. However, those foundation, walls, and a roof could be very different. But without those three elements, a building is not a building. Some foundations are made of concrete, some are made of wood, walls are made of different materials, they're placed in different configurations, and they have different effectiveness. They have different lifespans. Some work well and some don't work well. But there's always a foundation, there's always a wall, and there's always a roof to have a building. Just like in counseling, there is always a model or a theory, there's always a methodology, and there's always a set of interventions. So every time we talk about a type of counseling, we could call it a modality. That's a more technical word. It's the mode in which that we are doing some kind of counseling. Biblical counseling is modality. Cognitive behavioral therapy is a modality. Eye movement desensitization reprocessing is a modality. These are all types of counseling. Every modality will have these three things. The model or theory will answer questions of understanding. Methodology answers questions of flow. And then interventions refer to specific techniques that are used within a given session. Now, some modalities can share interventions, and that's okay. But what's important is that there is a clear and logical organization from theory to method to intervention. In this illustration, you see how model or theory should inform both methodology and interventions. You don't use an intervention or engage a methodology that isn't consistent with your theory. So it's important that you understand theory first, and that's what you're going to be doing in Module 2. You'll read Lambert and look at some other material, and you will come up with what are the key theoretical principles that form the model for biblical counseling as a modality. You'll illustrate them with some images and some symbols and some key points. In Module 3, you're going to actually work on methodology. You're going to say, okay, what do we understand about the catalyst for change? What are the relational dynamics between counselor and client? What are the core values and principles that are expressed and guide each and every session? Most importantly, in methodology, what is the sequence or the movement that a client goes through from intake to discharge? And then lastly, what are the interventions? Those actual exercises that are used inside or outside the counseling session as homework, or experiences that are used to take information from external to internal, from awareness to application. What are those techniques of integration, and how is conversation used to facilitate growth and change? All these have to be linked together. Let me illustrate or talk to you about something that can become a dangerous element and really cause counseling of any type to be ineffective. There is a danger in what's called eclecticism. Eclecticism is a random gathering of counseling interventions that are generally favored by the counselor. They're things that they think are cool. They either read about them or maybe they experienced something similar to them, and they think they're gathering the best of the best. However, even when you have the best of the best, if they're not put together well and in a meaningful way where they share a consistent meaning, then they aren't effective. For example, if you were going to play football, you wouldn't choose the best fishing rod and the best bat and the best golf club and the best lawnmower and the best exterior paint in order to play football. If you did, that would be a disaster. Eclecticism often lacks what we call efficacy, the power to actually bring change. And what happens when counselors just gather a bunch of different things and are constantly switching from interventions and methodology and theory that has no consistency to it, their counseling sessions become aimless conversations. We want to make sure that all of our counseling tools, our interventions, are connected to our model and our theory and are executed using our methodology. So be careful of just gathering things that seem impressive or cool to you. Assure that things are organized well. So in Module 2 and 3, you get to work through this, theory and methodology. Interventions will come more throughout the rest of this course and in some additional classes that you have. I look forward to looking at your illustrations of theory and your illustrations in Module 3 of methodology.